So hello, everybody. Welcome to the Be Well Live series. My name is Dr. Melanie Carminati, and I am a doctor of physical therapy and Pilates practitioner. I'm the founder of Inspira Physical Therapy and Pilates here in Park Slope and Carroll Gardens, Brooklyn, New York. And Inspira is a team of physical therapists who are also Pilates practitioners. We specialize in advanced orthopedics, Pilates rehabilitation, pelvic floor physical therapy, and we do different osteopathic techniques as well. So in our treatments, we infuse mindfulness a ton. Mindfulness allows for that full recovery from injury and also allows for prevention of future injuries. So I'm excited today to be chatting with Catherine Fugelsang about mindfulness during quarantine. So Catherine, thank you for being here. I want to first just take a moment to introduce you for those who are not familiar with yourself. So Catherine is an acupuncturist and Chinese medicine practitioner at Element Natural Healing Arts in Carroll Gardens, Brooklyn. And before joining Element, Catherine had the opportunity to work in a number of integrative settings alongside a variety of doctors and esteemed acupuncture colleagues, including the Department of Women with Disabilities at NYU's Hospital for Joint Diseases and Chicago Women's Health Center. She is nationally certified as a diplomat in both acupuncture and Chinese herbalism by the National Certification Commission of Acupuncture and Oriental Medicine. She received her undergraduate degree at Cornell University, graduated from the esteemed Pacific College of Health and Sciences with her master's in traditional Chinese medicine, and is a 2021 Pacific College doctoral candidate. So Catherine also has a bunch of areas of specialty training, including acupuncture for cancer patients, the study of integrative Chinese medical ophthalmology, treatment of gynecological conditions and fertility, and has advanced training as well in preventative self-care, stress management in order to avoid illness. So Catherine, thank you so much for being here.
Thank you for such a thorough introduction.
Yes, of course. Before we get into our chat, I see that some of the viewers have already given us a thumbs up, but for those who are viewing, if you are one of the first 5 to give us a thumbs up in the live stream comment section, you will win a prize. You'll get a virtual Pilates class from Inspira, and then you'll also receive a complimentary bottle of Plant Therapies Immune Aid Essential Oil, courtesy of Element Healing. So you get 2 goodies for 1 thumbs up. So I wanted to start off the conversation today, Catherine, with just chatting with you, given your varied background and training, to hear what a typical acupuncture treatment would look like for your patients.
Yeah, that's a great question. Of course, it depends what the patient is coming in for. And, I consider myself a general care practitioner. So people are coming in for pain, digestive issues, hormonal issues, as you said, oncology, ophthalmology. Typically with a new patient, someone has filled out a pretty extensive intake form, which is not only asking a number of questions about specifically what they're coming in for, but also their overall health history. And so when the patient comes in, I go over that health history with them. And, if someone is coming in for back pain, usually it's pretty straightforward, right? Maybe they tweaked their back doing some yard work, and we can get to the bottom of the issue pretty easily. But then there are other instances where I had a patient who came in one time and they had Bell's palsy, which is paralysis of the trigeminal nerve in the face. And, that was getting better, but then they were having all of these other side issues along with it as well. And as each treatment was helpful, but it probably wasn't until a 3rd or 4th treatment and after really investigating that we found out that they had Lyme's disease, right? And so it really depends. So there's a lot of investigative work, I guess you could say, when someone is coming in. And then with the treatment, we always do acupuncture, which typically lasts 20 to 30 minutes, where the patient is on the table, either on their back or on their stomach. And, people, they always want to know, how many needles am I going to use? And it really, again, depends on the condition that they're coming in for. It could be anywhere from 8 to sometimes, 25 or 30. It really depends. The patient is on the table, again, for about 20 or 30 minutes. And a lot of times we incorporate a number of other modalities into the treatment as well, whether it is gua sha, which is a tool that we use to scrape the skin to help with circulation and releasing fascia, cupping, which also does that. We may do moxibustion, which is an herbal heat therapy to either help with a certain area of the body or maybe specific points, which enhances the properties of that point. And so a typical treatment, first time treatment, is about an hour and a half, and then a follow-up treatment is an hour. And when someone comes in the first time, we will give them a treatment plan. Maybe they only need to come in 2 or 3 times. Other times it may be longer. It really depends. I would say on average, people come in between 4 and 8 times over the course of 4 to 8 weeks. And a follow-up treatment typically lasts about an hour.
Okay.
That was a lot of information, I know.
Yeah, no, but it's very thorough, and I would expect that, given all of the training that you have, that it would be thorough and adaptable depending on what the patient is coming in with and their symptoms.
Yeah.
So now, with this change in daily schedule for all of us, how can patients maintain the benefits of acupuncture even after the treatment session is completed?
So, part of maintaining it is coming to follow-up treatments, and then, typically patients will receive either herbal formulas or supplements to bring home with them. And I typically describe it as, a support of the treatment outside the treatment room, and it's supporting what we were doing in the treatment room. But a lot of times I will give them different exercises to do, suggest different dietary therapies. I many times am referring them to other practitioners, such as yourself, to help to aid with whatever they're coming in with. And, I think that it's also really important for the patient to pay attention to their body, after the treatment. So then when they come in for a follow-up, we can discuss what the changes are, if there have been, so we know if the treatment needs to be, if we're on the right course, or if we maybe need to change courses a little bit as far as the way that they're being treated.
Got it. So, in your experience now with this change in the schedule, how are you seeing this affect people's bodies, with the chi, with the energy flow, with meridian balance, all of that stuff? How are you seeing that present?
In so many different ways, as I'm sure that you have as well. I think that everyone's normal routines and schedules have been, turned on their heads, and hopefully, at this point, people have found a bit of a new rhythm and daily schedule, which helps to bring that flow of chi back onto, on course. But the way that, that I have seen it present in people is, one, overall just tension, right? Whether it's neck tension or just overall body tension. And so pain is showing up in different places of the body, digestive issues. And I think part of that is because of the tension and the stress, but also, as people are at home and they don't have the regular schedules that they've had, then they maybe aren't eating in a regular way that they were before. They may be eating different foods. And, maybe not staying hydrated as well, not exercising as much. And because people aren't exercising, they aren't able to, move through that built up, excess energy and stress. Headaches, insomnia, and just overall anxiety, right? Which can present with shortness of breath or tightness in the chest. And I don't know if you noticed a number of articles that were in the New York Times and other publications where, it was sort of going through, you're having some symptoms that sound like the coronavirus, but actually it may possibly be stress. And I think that was, that it was showing up in that way for sure.
So in terms of the anxiety that you mentioned, I know when we spoke a few weeks ago, I was talking about sympathetic overdrive and just having encountered that a lot with the patients who come to me for treatment, and how that presents and symptom-wise, they're feeling that anxiety and they're just feeling that, excess and buildup from the fight or flight response that's just ongoing and chronic in their body. What recommendations or what kind of home tips or do you have for that?
Yeah. There are a lot of great home tips. Some of them we've heard many times before, but I still think that they are worth repeating. And something that I already mentioned was, and I know that I found it helpful for myself, is just having a bit of a routine, right? And even, just making sure to like get up in the morning and take a shower and get dressed like it's a normal day. And I know that sounds very simple, but I think that there's something psychological with that really just kind of helps to set the tone. Another one that everyone always says, but there's so much truth to it, and that is breathing, right? And really making sure to take time to take deep breaths. And I do talk with my patients a lot about just deep breathing or meditation, and that you don't need to, spend, an hour or so a day doing it. Even 2 to 5 minutes a day can be very helpful. And, what is going on in your body when you're taking deep breaths is that it's actually, it's stimulating the vagus nerve, which is the largest nerve in the body. And by doing that, it's helping to increase the parasympathetic nervous system, right? So when your autonomic nervous system is in overdrive, you want the parasympathetic nervous system to kick in, and that will just help with, calming and with breathing also, right? Because like sometimes we feel as though we can't breathe, and it also, I think, really helps with, there's a lot of like brain scatter that's going on right now. and so, just helping to bring oxygen to the brain, and that helps just to calm people down. So, so that's one thing. I think that there are also a number of foods that people can easily eat and incorporate into their diets that either, they have nutrients in them, which then either help to support dopamine or serotonin, which will help with anxiety or with sleep. Some of those foods are dark greens. And, as we're going summer, luckily we have an abundance of those coming our way. We also, as we're going into summer, we don't want to eat too many raw cooling foods because that can upset our stomachs. So maybe sauteing it with some garlic would be good. Oatmeal is very good because when we're stressed, we do crave carbs, but that's because our body wants to trigger the parasympathetic nervous system. And so with carbs, there is an effect of working with serotonin to help to calm the parasympathetic nervous system. And one other suggestion that's easy that you can just add to to either smoothies or eat on their own or put into salads are seeds. And so pumpkin seeds, flax seeds, and those are high in magnesium, which in turn is very calming for the system.
Wonderful. Those are all great tips. Thank you for that. In terms of acupuncture or acupressure, I'm sorry, acupressure points, are
Mhm.
there specific points that you recommend for patients in addition to what you just listed?
Yeah, definitely. So, I think that there are a couple that I can show you. Hopefully, it can be,
Yeah.
presents well over, over the video.
Yeah.
But one is actually on the wrist,
Okay.
and it's just if you just come down from the wrist here a little bit, it's in between two tendons.
Okay.
Really, your finger will just fall into it, and
Okay.
if you really press into that point,
Uh-huh.
not only is it good for digestion,
Mm.
the C bands that people wear either
Right.
for, when they're traveling or for pregnant to be moms. So that helps with digestion, but it actually opens up the chest as well. So that's a really good point just just to help with breathing and calming. And it's on what we say is the pericardium channel, which is the heart, right?
Mm.
And so it's the outside of the heart. So it's calming. Another point is just on in between your eyebrows,
Mm-hmm.
on your forehead. And this
Mm-hmm.
point, people call it the third eye, but it's also right in front of the pituitary gland, right? Which
Yes,
is
of course.
the dispensary of your hormones. And so, by pressing this, it does have a calming effect. And then the
Mm.
other one is just on the top of your head. So, you could actually just take all four fingers and go to the
Mhm.
center of your head and, just hold and press down. And if you hold for a minute, you'll really feel, from the top, everything, just start to release. And yeah.
It feels
So
nice.
those are three just very easy points and easy access points. So
Great. Thank you for sharing that with us.
you're welcome.
And in the same umbrella of um, sympathetic anxiety related treatments, what kind of herbs do you typically recommend and use for that?
Yeah, with herbs, I know that we had spoken about that. And what I will say with especially with Chinese formulas, Chinese
Mm.
medicine formulas, it really depends on the patient and their overall constitution and their sort of underlying issues that they may have. But there are two that I think are kind of good go-to formulas. One is called Free and Easy Wanderer, and there's a Chinese name for it, but but that's the easiest. If someone wants to look it up online, Free and Easy Wanderer, and that really helps with irritability and stress.
Mm.
And then another one is Peaceful Warrior, and that is very good for anxiety and also insomnia. So I think that those are two go to very safe, benign, herbal formulas that it they don't have interactions with other medications or other issues that a patient may have. um, and then as far as supplements go, I I do think that ashwagandha is a really wonderful
Mm.
supplement, just because it helps with the after effect of stress, and right, it's sort of like
Mm.
a cleanup of what is going on in the body, while and after you've been through a very stressful situation. Um, and then there are um, two homeopathic formulas. One is called Quietude, and it's very easy to get, and that helps with sleep. And the other one is Sedata, which is a very calming homeopathic formula. So
Great. Yeah, those are all great herbal recommendations. And then I know that you had said that you would tweak it and modify and potentially recommend other things depending on the patient too.
Yeah. And that's why I don't want to, right, there are so many different
Of course.
formulas that we use, but they're really tailored to what's going on with the patient. And also, we typically don't recommend herbs and supplements for people unless we've seen them.
Right.
And so people are more than welcome to contact us to talk with us about, about possible different herbs and supplements if that's something that they're interested in as well.
Great.
Yeah.
Any final self-care, mindfulness tips that we haven't mentioned already that you want to throw out?
Yeah, well, I think that, we've all been, not connected with people or at least in the same way, right? Like we've all been able to do FaceTime and Zoom. We all have Zoom fatigue at this point. But I do think at this point that it is, it's really important to connect with people in a safe way. And I think that we have a lot of information now and ways that we can do that. But I do think that it's important to connect with people and to get out of the house and to go on walks, maybe not in the middle of Prospect Park because it's,
Yeah.
or go at times when it's kind of off times, but, just to get out and to start connecting with friends and to go on social distance walks or social distance bike rides. I know that one of our other practitioners that she's been doing that with some of her friends, and yeah, just also there is not only the pandemic that's going on in the world right now, but we also have so much going on in this country, and so just checking in with your neighbor and seeing if there's anything that they need, and just making sure that that they've been connecting with people, because I think that that's what you know it's it's easy to forget how many people may not have left their house literally for 3 months, right? So if you have someone's phone number that you haven't spoken with, or if there's someone that you can just stop by and say hello to them, just from the stoop, I think that that's really important. Again, I know that it's really simple, but I think it's really important at this point. So
That's great. Yeah, remembering and reminding yourself that we all are connected and that we all are in this together right now is really important. I see just in the comments, I wanted to just bring it up since someone just asked a question. They're asking if, this is from Josephine, she's asking if acupuncture is now used for mainstream treatment for cancer at different cancer centers.
It is. It's utilized at many different cancer centers across the country. In New York at Memorial Sloan Kettering, they do have a number of acupuncturists on staff, and it is used in conjunction with Western treatment, right? And it is used to help support the immune system, and also the unfortunate after effects of the oncology treatments. So whether it's pain, like neuropathy, nausea, fatigue. So yeah, I would, and people do come to Element for that sometimes, but I would say that I know people who have worked at Memorial Sloan Kettering and in other places around the country, and they've had really successful programs. So
That's great. There's one other question. Sorry, this could be a very quick answer. Someone just asked, when is Element opening up again for in person?
That is a great question, and
Yeah.
we are slowly we're doing a soft open in the next week or two, and just making sure that we have everything in place, and so seeing a couple of patients and just making sure that we have the routine down. But there will definitely be an email that goes out to everyone once we are open. But I would say in the next week or so that we will start seeing patients again. It won't be quite as full as, as it typically is, just because we'll have to space things out. But yeah, we will be opening.
Okay, great. Well, Catherine, thank you so much for sharing your knowledge and all these tips. I know that everyone's going to benefit from it so much. So thank you again for this.
Yeah, and thank you for reaching out to Element and to me. And I'm, this was really wonderful. And yeah, hopefully we will see you soon.
Yes, I just want to finish up by thanking everyone who's viewing. For those who were the first 5 to give a thumbs up, we will follow up with you after this is over to get your contact info and then get you signed up for a Pilates class, and then also get your contact info to Element so you can get your bottle of plant therapy immune aid essential oil. Tomorrow, I will be bringing on Dr. Allison Shrikande. She's a pelvic rehabilitation specialist here in Manhattan, and we will be chatting about pelvic pain. So for those who may be interested, tune in again tomorrow, same time, 5:30 p.m. And that's it. So see you then. Catherine, thank you so much. And everybody,
Thank you, Melanie.
stay well, everyone.
Bye.
Bye.